I want to make certain that I welcome our guests who are joining, remind everyone that their cameras are off and their mics have been muted. If you have questions during this session, please use the text chat feature in Zoom, and we're going to pull up those questions as time allows. And first of all, I want to say that we're really thankful that we have the A team here present and helping us communicate with our members. Not only do we have Oklahoma Commissioner of Health Lance Frye, but we have Deputy Commissioner Keith Reed and Jackie Shawnee, Chief of Staff to Commissioner Frye, to help us walk through some of these things. And we have our very own Senior Vice President of Government Affairs and Public Policy, Adria Berry, with whom this team has worked very closely over the past year and months, and in our new role here at the Petroleum Alliance of Oklahoma. So I just want to say thank you very much for joining us. Dr. Frye, let me tee up just a little bit with your bio before we kick this thing off. You have led the Oklahoma State Department of Health's efforts to establish and expand COVID-19 vaccine distribution efforts since you came on. In addition to serving as the state commissioner, as the commissioner of Oklahoma State Department of Health, you also serve as an interim department chair, residency program, and professor of obstetrics, that's tough for me to say this morning, OBGYN at Oklahoma State University for Health Sciences. Thank you very much, Commissioner Frye, for joining us, and thank you to the team. I want to start by just saying we want to give a shout out to our frontline healthcare workers and those who are supporting them today. We all depend upon them, and we are so thankful that they are performing that role. That's such a critical role for us. Dr. Frye, with that, we can ham and egg this around as we need to, but we have some good things to talk about regarding vaccinations. We also are sobered by the number of U.S. persons who have been affected by this illness, as well as the deaths, but we have a lot of recoveries as well. So with that, Dr. Frye, I'm gonna just lean into it and let you kick it off here, and we'll go forward.
Great. Well, thank you for that introduction. And it's always wonderful to see Adria. She, I have to tell you, she was there from the very beginning of this COVID response and sat in that what we call the MAC, where all the operations, all the agencies from throughout the state all came together every day, and we briefed the governor 7 days a week for a very long time. And she was always there, so it's always good to see her. I feel like she was in the trenches with us. So yeah, and I think that introduction was appropriate because while we are near the finish line, we are not there yet. It's not time to take victory laps. We have today we had another 3,142 cases positive in the state, 34 deaths, and it's just kind of there. I mean, it's everywhere. I know people. I think I had 3 calls this morning from people that are saying, "Hey, somebody's tested positive, or I tested positive, and I'm not going to be working from home today." So it's really, really out there in our communities right now. It's the highest percent positivity that we've had through this whole pandemic. Our hospitals are near capacity. They're not at capacity, but they're near capacity, and they're all working incredibly hard. So that's the sobering part of it. The good news is we have vaccine in our state, and we are 8th in the nation as far as states that are getting the vaccine per capita to their people. So, and that's Keith Reed's put together an amazing team of people that planned and now are executing that plan, and they're doing an amazing job. So I'm not going to take a lot of time myself. I'm going to let Keith start talking about vaccine and where we are.
Great. Well, Keith, thank you very much for joining us today. Can you talk to us a little bit about vaccine delivery? We know there is an opportunity to register for vaccines online, and how is that distribution effort working?
of all, thanks for having me. Really appreciate it. Also want to give a shout out to Adria. We worked really closely in the early days of this response, and miss seeing her on a daily basis, which is where we were at there for a while. Yes, so we do have a pretty good distribution system going right now. It's a challenge. This is a huge logistical lift. This vaccine is complicated. It's just like anything else with COVID. It's anything but easy. Storage requirements are exceptional compared to what we would normally see with vaccine, with ultra cold storage requirements. It's a 2-dose vaccination, which further complicates the response. You can't mix the manufacturers. The manufacturers have different boost cadences. One, Moderna is a 4-week cadence. The Pfizer is a 3-week cadence. A lot of complicating factors that are at play with this, but our team has just done an outstanding job of planning for this, pulling together with a lot of changing information. I can tell you the data, the information we get from Operation Warp Speed, and I'm not throwing stones because it's just a complicated response, but it changes every single day. I was getting new information at 7 o'clock this morning that I'm like, okay, back to the whiteboard. Let's clear the whiteboard and start over after some of our discussions yesterday based off of what we got. And that's just been ongoing. Our team has been very, very adaptable. Let me give you just a little bit of information about the portal we rolled out. That was one of the big questions everybody asked about. And I want to prep that by saying the portal was never meant to be the end all be all for all Oklahomans. We were putting something out there that we could really get a large mass of the population that could use this portal and could get scheduled in that way. The portal is tied to our public health distribution system. And while this is a huge public health initiative, the public health agencies are by no means the only ones doing this. We're doing this with an incredible amount of partners out there. And the plan to get this across the finish line is going to have to involve a lot of partners coming on board, vaccinating people that they're taking care of, or joining us in vaccination efforts. So there's a lot of partners going to come to bear on it. So this particular portal, as of this morning, we had 427,000 people that have registered through our portal.
Great.
Of those, there's been over 40,000 appointments that have been made. There are more appointments. We're in the window right now between late Wednesday and early on Thursday throughout the day. That's when the majority of the appointments are populated in this scheduling portal. So we have appointments out there. We had close to 5,000 appointments that were available as of 8 o'clock this morning. More added this morning as we move through the day. So this is kind of I heard somebody say, what's the best day to catch fish? This is the day to catch fish when it comes to getting a appointment for the vaccine. But the limiting factor is that our appointments are tied to vaccine inventory. We're not putting appointments out there that we can't put vaccine inventory against, because we know once you do that, you can't walk it back. All right. So we're only putting in appointments as vaccine availability is known to us. We were told on Tuesday, late Tuesday, that we should expect to receive 48,475 doses of vaccine next week, for example. Not all those are going to go and be bumped directly up against an appointment in this scheduling app, because we are distributing vaccine not just to our public health system. We're engaging the private providers as well. At this early stage, it's mostly big hospital systems that we're getting vaccine to, because they're still vaccinating our priority 1 populations. We have been very, very intent on moving through this process in more of a overlap fashion on these different priority groups. We never intended to complete the first group, finish with them, now let's start the second, finish with them, now go to number 3. We wanted to get enough vaccine and opportunity out there to get those started, knowing that we had enough inventory that we could continue opportunities for them. But as soon as we felt like we had enough to start offering for the next group, we would overlay that group onto the plan. So that's how we quickly moved through our priority 1 groups, and now we are at 65 plus population.
I just have a quick quick question for you. So just so they can see how dynamic this is, how many times this week have we gotten a different message about vaccine supply and how it's moved forward?
Well, how many days are there in this week? 4 days? Every day. Every single day we have gotten, and I'm not talking about minor messaging changes. I'm talking about major messaging changes, major strategic information coming out of Operation Warp Speed, and then what they put out on Tuesday, I found out this morning, well, that wasn't exactly representative of what we intended, and their own staff are even confused about what was put out. So yeah, incredible. I mean, it's a huge undertaking. The logistics are enormous. So we know there's going to be a lot of that. You're going to have some, fog of war. You're going to have those kind of issues. We know the next few days are kind of in that gray area, that the direction we get from Operation Warp Speed is absolutely subject to change after the administration change, because you have different direction coming at that point, for example. So yeah, we're absolutely ready to turn on a dime in order to make adjustments. And that's been what I would consider a big part of the success, is our ability to adapt to that. And like I said, we've been adding these groups. We wanted to make sure that we wanted to make sure and get vaccine from the freezer into arms. Vaccine in the freezer does nothing for anybody. And there's two things that we're trying to do here. We're trying to provide individual protection for those that we vaccinate, and everybody pretty much understands that. Trust me, from the calls we get, everybody understands how important that they get their individual vaccine, because that's what they're really pushing for. But the other thing that a lot of people forget about is we're trying to get enough people vaccinated that we can interrupt the transmission of the virus in the community. And in order to do that, you have to have masses of people. You have to have large numbers of people vaccinated. That's one reason we quickly engaged the long-term care program partnership with CVS and Walgreens, because we felt if they could do what they were saying they could do and go out and vaccinate those groups, those are very resource intensive groups. We could run a concurrent plan and immediately go into some mass vaccination clinics and start getting people in the community vaccinated. So we've had success. Mass vaccination clinics have been very successful. For those that have been going through those, the feedback we've been getting is fantastic. We've avoided the Florida scenario. I don't know if you've noted what happened in Florida, but they had seniors that were basically camping out as if they were trying to go to a concert in order to get a limited number of vaccines. We have been very intentional about trying to manage expectations for that population and others by using appointment systems to kind of serve as a ticket to get your vaccine. There are always challenges. The portal that we launched, not everybody, believe it or not, uses a computer. Not everybody has internet. We've collected thousands of names from our 211 system that we set up to try to provide an option for that. We've collected thousands of names of contact information that we are redistributing out to the appropriate county health departments around the state, so that within the next few days, they can reach out and coordinate some appointment opportunities for that population as well. We've had to roll this out very rapidly. We started meeting in August, but the way things have changed, a lot of quick movement. We have been intentional that we were not going to let perfect get in the way of good, because if I promise you, and I think you've seen this in some other states, being very regimented, being so strict with those different population groups, trying to move through and just make sure they get everything right because they're afraid to step outside the lines, doesn't really serve the citizens. So I feel like we've had good success on that. So that kind of an overview on where we're at right there. I think you probably got some questions.
Well, I want to sing your praises. The numbers that I see on your website this morning, it's almost $100,000 doses administered almost. We're getting pretty close to that.
Actually, we're more than that. You probably had some data numbers that are posted. We have over 182,000 doses
Oh, that's
that have
fantastic.
been put in arms so far. And,
Fantastic.
and actually, that's a data lag as well. One of the other big challenges for this is we only get credit for what is actually put into the system. You know, everybody knows that old adage, no job is done until the paperwork's done. And for us, that's entering into our immunization registry. So those numbers are only reflecting what's already in the system. There's typically a lag in that data. So I suspect that we're over 200,000
That's
today
fantastic.
on that.
Fantastic news. Excellent work. Now, so you talked a little bit, Keith and team, about some overlap between phase one and phase two. And I assume that that's happening a little bit in at a different pace in different parts of the state. Is that how things are sort of happening? I hear about folks driving from a more populated county to a more rural county to get their vaccination. Can you address that a little bit?
I can talk about that for a little bit, but yeah, absolutely. I mean, we don't want to put the brakes on anybody. So, you know, we are wanting to get vaccine out. And so there are different areas of the state, different districts and regions that are further along than other parts, but we are not going to tell them to wait until, you know, the other regions catch up before they move forward. So they're definitely in different parts, or I'd say different phases or different levels in those phases throughout the state. We don't want people getting in buses and going out into the rural areas to get vaccine because, you know, we're trying to do this as orderly a manner as we can and make sure that we have adequate supply in the areas. You know, we try to distribute that out based off of some different parameters we look at, but one of them is the burn rate. We want them to, our goal is to, when we get vaccine in the door, we want it all in people's arms within 7 days. Every week we want to be out of vaccine. And no matter what the supply is, we want to make sure we flex up or down to make sure that gets out in 7 days. Great. So we don't want that, but we're not going to police it either. You know, we don't want to, we're just not going to do that. So, but it does happen, and not something we encourage. There was a bus of people from Tulsa that ended up down in Ardmore. Was it Ardmore, Keith? They went to Ardmore and
yeah, Ardmore yesterday. Yeah.
But they all had gone in and they all had appointments. They'd all gone in the system and made an appointment, and they took a bus down there with a bunch of people from Tulsa, which, you know, is frustrating for us. We don't want that to happen, but at the same time, it's like, well, you know, we want people to get vaccinated.
Well, as an Ardmore native, I'm certain that they just came to see the beautiful scenery around Lake.
That's right.
We have a couple questions from some folks who deal with the health safety issues. The question is, you said that 48,000 plus doses were expected next week and that more than 5,000 appointments were scheduled thus far. Are the remaining 43,000 doses all allocated to hospitals and other providers? Also, are the county sign-up sites now inactive?
Okay. Yeah, let me clarify on those appointments. So I said there was about 5,000 that were available this morning. From yesterday, it looks to me like there were about 10,000 appointments that are already filled that were added against those that we're receiving next year or next week. There is about 5,000 available, and then there will be more appointments populated into the system by the different points of dispensing, the different pots. They have to go in and enter as a user. They go in and enter how many appointments that they can handle based on and assign that to a site out in the counties. So of the 48,000, I don't have the exact numbers on how much of that will ultimately be appointments and how much will be allocated to healthcare providers. It will be more will go towards appointments than go to providers at this point, because as we're moving through this phase, we're starting to get more and more healthcare workers taken care of. So the heavier burden or the heavier percentage of what we have coming in currently is going to be moving towards a 65 plus population. I also want to clarify related to that, when this scheduling portal is tied to the public health system, when we send to pandemic providers, and pandemic providers are anybody in the private sector that has signed up with us and agreed to manage the vaccine appropriately according to manufacturer directions, has agreed not to charge for either the vaccine itself or the supplies that come with it, have agreed not to turn anybody away for their inability to pay. For those individuals, and they've agreed to follow our plan on which groups we're doing, they will use their own type of scheduling system. So there'll be lots of appointments that'll be available through their own individual systems as well, once we get enough volume to get vaccine to them. Now, the question about the county sign-up sites that go inactive, this is a great opportunity to kind of point out the way we've been flexible and really nimble in our response. We quickly recognized, okay, it's time to move to 65 plus and open this up, because as soon as I started hearing of some clinic sites that didn't fill up completely because they didn't have enough people, it's like, okay, it's time to pull the trigger. We got to move to 65 plus. But yet at that point, we were a few days away from being able to launch our portal. And I know we got accused of having not having a statewide plan because people did a little different in the counties, but we initiated that. We told them, you need to set up pods. You know how to do it. You know how to set it up, use local resources, set up these pods. Let's start doing 65 plus. So they initiated that before a portal came online. But now that we have the portal in place, they are disbanding that approach and they're rolling into the portal so that we get everybody on the same page. But we just did not want to wait on technology to get vaccine in the arms. We knew that we had the ability to do it.
And Keith, just a clarification on that. So that portal is a system that we have for people to go online, sign up and make appointments. But to enable that to work, there are multiple different, I'm thinking about all the providers throughout the state and all the different medical record systems that they have and scheduling systems and everything. There's no way that we could integrate an appointment system that would work with every provider out in the state. All these pandemic providers are making appointments on their own outside of our system. So you know, once we get to that point of our distribution, which we hope will be soon, then individual providers, and we don't want to put a list out of people that might have vaccine but don't have vaccine, because it's gonna, you know, their phones will just do what our phones are doing right now, just crazy. So, but once we distribute vaccine, you know, we will let people know where it's available, but they will be able to just call those people directly and get an appointment.
That's right.
Now,
And
go ahead, Adria.
thank you. Colonel Frye, I just want to say thank you for your comments earlier. It's always good to see you, and Colonel Reed as well. I miss you guys. So the folks on this call are members of a critical infrastructure sector. We know that's a really broad term, but you know, these are oil and gas companies. So our members here at the Petroleum Alliance are really interested in just learning when they could possibly expect their employees to be able to be vaccinated. Do you have any insight on that? I know that's a tough question because things are changing daily, as you just said, Keith, but if there's any just idea of when they can expect to be able to see their employees being vaccinated, we'd appreciate any insight.
I'm going to let Keith answer that, but I do want to say that we are telling every organization, no matter how large, to prioritize their people, because a lot of times they will fit into phases that are already open. So for instance, if you have somebody that's 65 or older, get them vaccinated right now. You know, once we open up below 50 or below 65 with comorbidities, I'm sure you got a lot of people in that area. So get them vaccinated. Just like we're doing with teachers right now. I mean, we have a list. We got with the Department of Education and got a list of every teacher in Oklahoma that's over 65, and we are trying to get them vaccinated right now. So think about it in that manner, but I'm going to let Keith talk about the timing of the rest of it, which is, I already know his answer, but I'm going to let him talk about it.
Yeah, he took the easy part of that answer.
Do you mind if I ask one quick kind of medical question? Is there a list of comorbidities that are the most prevalent, just so people will know when they're filling out that portal questionnaire?
You know, so
Comorbidity?
yeah, so we're not, again, it's difficult for us to police that. We can't make people show up with their medical records and show us what they have. But the things that make them really high risk are like obesity, diabetes, any kind of like asthma or COPD, history of lung problems, if they're immunocompromised, heart disease. So there are a lot of people in Oklahoma, unfortunately, that fit into those categories. So it's a very large group of people.
Okay, thank you.
That's absolutely right. And if you go through the scheduling portal, and I keep talking about the scheduling portal, but please understand, we recognize that by no means is this the solution for everybody. It just helps with a large portion of the population. Related to this question, or both those questions, it's helpful because the comorbidities, there's some listed on there that somebody can go in and they can identify if they fall into those categories. The other part of that is if you go in and the scheduler is itself a screening tool. So when you go in, and it's important that people go through and answer each one of those questions, because each one of those questions helps to align them with a priority group. So if I go in today and I am healthy, I have no comorbidities, I'm under 65, and I work in oil and gas, and I feel I'm going to be in critical infrastructure, that is and there's a link to the different groups that are in critical infrastructure. I'm going to be identified in phase 3 critical infrastructure. Now that's not time wasted. You're registered in the system. What we do on the back end is as we add new groups, we turn that on in the back end. So when we get to that group, we will flip on in that system. All right, now we are accepting appointments for critical infrastructure. You will get a notification. You'll get an email notification. You are now eligible to go in and look for an appointment in that. So that's a way in which you can use the scheduler to screen yourself and find out where you fit. But as the commissioner said, if I go in and I identify myself in critical infrastructure, but I am also over 65, or I have a comorbidity or something like that, it's going to default to the highest level, the highest priority to get vaccinated.
Great. Thank you.
Oh, and to your question about when, yeah, I don't know. That was that was why he was saying when he knew what the answer was going to be. My official answers are it depends on vaccine supply, and that is just absolute bottom line. If we have a large bolus of vaccine supply that comes in the state, and we bump that against the populations we're in, and we see that that's enough to get us through that population and into the next one, we're going to start adding the next one. So it's completely driven by vaccine supply. And that's a question we just don't know about.
Yeah, and uptake, right? Because we don't know how many people
right. Absolutely.
in those categories. So for instance, 65 plus, what that's 600,000, basically about 600,000 Oklahoma. Yeah. It's a large group over 65. So we're trying to, and again, we're not going to wait till we get through that group before we open up the next one. We're going to keep moving through this, but we still have a ways to go in that age group.
And so it sounds like as a basic bit of advice to all of our member companies, ask your employees to get registered on the portal right now. Correct. So they know where they fit within the phases and can receive that information.
Absolutely.
We have a couple of other comments and questions coming through the chat line. And the first is about how to encourage those who are non-tech savvy, the 80-year-olds and up, how do we help them? Are there alternatives to schedule that we need to make families aware of? And then the other one is regarding scheduling portal, indicated that someone was immunocompromised, but is still slotted into phase 3. Why is the question?
So in the first one, let me answer the first one is, yeah, we absolutely recognize that there are people that are not tech savvy. So we did a couple things. And we had a little bit of communication effort that had to take place with 211 on this, but we wanted 211 to be that easy access so that those people could call 211. What we did is we added staff, between 35 and 40 staff, as a subsection within 211 that could take on vaccine questions, assist walking through portal issues, or collect name, contact information for those that don't use email. They wouldn't be able to follow the system in order to get an appointment. And then what they're doing is they're collecting those informations, and then we redistribute out. They can't give an appointment at that level, but they can redistribute the information to our local health jurisdictions that can then reach out to these individuals actively in order to help them get an appointment. And then we've asked our pods to set aside appointments, blocks of appointments within their pods that are not necessarily tied to the scheduling app, so that they will have appointments available to help fill in for these people. So that's the mechanism by which we can support them at this point using this system. Now, as the commissioner mentioned earlier, when we expand to pandemic providers around the state, then a lot of people would be able to get it through their primary care physician or through an urgent care or some other group like that. Now, the question about the scheduling portal, that's a pretty specific one. I would actually ask if we could collect, if you guys were able to collect maybe either a name and email address and even a screenshot of the email or something. I would like to get that to our Microsoft team, because that's not supposed to happen. And we have been very, very committed to performance improvement and to QA on this project. And anytime we find any kind of glitch like that, we want to know so that we can go in and figure out, is there a problem? Is there some reason that's missed? Because I just look at those as opportunities for us to further refine the system. So I would love to get that specific info back.
Great. So for that questioner regarding the immunocompromised question, if you will email either Adria or me, it's brooke@okpetro.com and adria@okpetro.com, and we'll make certain that the team here gets that and can work it back through their system to see if they can make some improvements. Now, so we talked about the need for employers to encourage their staffs to register, sign up for vaccinations. Now, what steps should employers and employees take once vaccinations have been administered? Are we back to business as usual, or are other precautions still necessary?
Other precautions are still necessary. It's 95% effective once you're 10 days past your second dose, right? So it takes a while to get there, and people are going to be, they're not all going to be crossing that line at the same time. And you just don't really know, for instance, in your communities, in your businesses, who's coming in and out, who's been vaccinated or not. So it's going to be a while until we get back to normal, to be honest with you. We have chosen, I've basically just said, hey, we're not going to quarantine people that have been fully vaccinated. So if you're 10 days past your second dose in the state of Oklahoma right now, if you are exposed to someone that had COVID, I'm not going to quarantine you. I'm going to tell you, do the right thing, take precautions, try to stay away from other people, make sure that, if you develop some symptoms or anything that's totally different, then you need to isolate. But the CDC has not said that. There's not enough information out there yet for them. They move kind of slow, on things. So they're not making that statement. But I realize that, our team has talked, and it's just not, after all this time and where we are and in this marathon, the public in Oklahoma, general public in Oklahoma, is not going to accept me telling them that they have to quarantine after they've gotten fully vaccinated. So we're not gonna force that, but we're gonna ask everybody to do the right thing and take personal responsibility for where they are. But it's not going to change for a while. It's just going to take time.
And to your point, Dr. Frye, what is the efficacy rate for these vaccinations?
It's about 95%, which is unheard of. I mean, it's your flu vaccine is maybe 40% that we get every year. So this is highly effective. That's why I just can't tell people they're going to have to quarantine after they've gotten fully vaccinated. It takes both doses. That prime dose, this vaccine is the ones that we have right now our new technology. It's really pretty amazing. It's based off of many years of study, but it's new technology for vaccines. And so there's no live virus in this at all. It's very safe. What it is they've taken those spike proteins. You've seen the pictures and the drawings of the virus. It has all these spikes on the outside of it. And so they've taken this is an RNA virus. They've taken the RNA from that spikes, those spikes, and they have this virus is a messenger RNA. So what that does is it's a messenger RNA. It's kind of like the recipe to make cookies, right? So you're injecting the recipe into your body, and your body knows what to do with messenger RNA. It builds things from it, right? So your body sees that, and it tells your body to bake those cookies, right? So it tells you to make these spike proteins. And so you produce those spike proteins, which then your body sees as something foreign. And so it starts a immune response towards those. It starts to produce the antibodies and things that you need to attack that and protect yourself from it. So that's the initial one. So then when you get the second one, what we call a boost, then that really comes on later and kind of supercharges that response. It gives you some more of those spike proteins. It gives you, it tells your body to build some more of those, and it goes and grabs those memory cells that you've produced for this to produce another response. And it's a phenomenal way of doing it. That messenger RNA is, by the way, as it's used, it is chewed up and destroyed. So there's nothing left in your body. It doesn't incorporate into your genetics in any way, or your RNA or DNA or anything like that. So it's all gone, but it causes you to produce an immune response towards it. So highly effective, very safe, and certainly something that we want to encourage everybody to get.
And so just really quickly, just to clarify, so someone gets that first round, and then depending on the brand, it's either 3 or 4 weeks later, they get the second dose, the boost. And then do people after that, that's it? They don't need to get another one every year like we do a flu shot? Or do we know that yet?
We don't know that yet.
Okay.
We hope that they don't have to get another one, but we just don't know.
Okay.
I think the good thing is that a coronavirus itself is a pretty stable type of virus. I know you've heard about some of the mutations, but in the big scheme of things, that's been fairly minor compared to flu virus, for example. Flu virus, as it makes its way around the globe and comes to the different hemispheres, it undergoes a lot of mutations. And that's why it's different every year on what to expect. Coronavirus is much more stable. So we're hoping that we get by with just these initial vaccines and we don't have to do boosters. Now, I also wanted to just add on what the commissioner was saying. A lot of people ask, well, why would you even ask me to worry about wearing a mask or something after I've been fully vaccinated? I'm protected. Well, keep in mind that you're exposed to something. The way the protection works, you're exposed to the virus in the environment. You take it into the body, and then the body eliminates it, takes care of it, but then it sheds it out. So there is the potential, they're still studying, there's the potential that maybe what you shed out as your body's doing what's supposed to is possibly still contagious, but we anticipate that would be very low amounts, and that's just kind of the rationale behind that.
Interesting. Okay, good to know.
Question on the chat line. Do we expect a single shot vaccine in the near future?
We do. Johnson & Johnson is working on a single shot vaccine. We don't know yet when that will be coming on board. I would love to have a single shot vaccine in the arsenal right now, but we're not there yet. Sometimes I hear, next month, I hear a couple months, but there's definitely a single shot in the works, but we wouldn't yet know the efficacy either of that. So again, as the commissioner said, 95% efficacy that exceeds pretty much all of our childhood vaccines, and it's just something you don't normally see with a vaccine. So those single dose, I don't know that they would get up to that level, because what we're looking at, the first shot for the current vaccines estimated around 50-55% efficacy on that, so you get some protection from just the single part of the shot. But we need to see some more data on the Johnson Johnson as the example, the one that's working on that single dose.
One question from the chat line. You previously indicated that you were not holding back second doses of the vaccine, as the federal government had guaranteed they were holding those in reserve. Has your strategy changed at all due to the recent decision at the federal level to release all doses?
Every day this week. Yeah, so,
Yes.
yeah.
Yes, the strategy is changing every day. So yes, we continue to get new information about that particular holdback. And that's something to where I was even getting clarification. I mentioned 7 a.m. this morning, I was getting clarification. It's really about what does that reserve that they have been telling us they're holding back for us, how is that actually manifest? Is that physical form, or is it in the pipeline? And we've been in all indications we'd had actually up till this morning was that was physical holdback of second doses. I got some indication this morning that, well, that may be pipeline doses still in the works. But our strategy to provide second doses based off manufacturer directions has not changed. And we are looking at what the federal policy change is going to mean for us on vaccine coming in. We are looking at managing second doses through the appointment system to make sure everybody has the opportunity to get their second dose. But I do want to take this opportunity to tell everybody, while the manufacturer's recommendation is at 21 days for Pfizer, 28 days for Moderna, our two vaccines we have right now, that doesn't mean that if you get it on day 35 or 40 or something, that you lose out on the efficacy of that drug, and that you're not going to get your 95%. It's just that those were the time ranges they studied. Historically speaking, we know that vaccines usually increase in efficacy when you spread out those booster doses a little bit. So I put that out there because if we start getting into tight supply and some people start to think that, oh my goodness, I may not get my vaccine on day 28, I may not be able to get an appointment till day 32, that's okay. That is absolutely okay. We just ask for flexibility, working within those systems, a lot of moving parts, and that's actually just really good if you get it within that time frame.
Great. Team, we are coming up on 45 minutes plus on this. This is an incredibly important topic. We know, I hear you say that we need to encourage our members to encourage their teams to sign up to get vaccinated. When we move into phase 3, that covers all oil and gas workers. That's not just the guys on the rig, correct?
Absolutely. Trust me, we understand how important support personnel are.
Okay, great.
We can't operate without support personnel, so we get it. They would absolutely be included.
So what I would like to request, if there are things that we haven't covered, questions we have not asked, that you want to make certain that you leave with our viewers, can you please touch on that? And then Adria, you might have some cleanup, and then I have housekeeping things that I would like to cover for the group.
I would just like to remind everybody, because to me, it's really important that everybody understands this is a partnership with us, not just the partners that are executing our clinics, but every Oklahoman's a partner in this. And what I mean by that is we need everybody to understand that there is not enough vaccine for everybody to get an appointment right now. So we need patience from the public. The frustration about waiting is certainly understood. We don't hold that against anybody, but we just ask for patience and grace for our staff and our teams that are working so hard. They're not production. They can't produce vaccine. They can only work with the vaccine we got. And we're doing everything we can to provide that in every way possible. We talked about people going out to rural counties to get vaccinated. We would never hold anybody back from that. We recognize that's something that we need to adjust to. So we are working with Tulsa, for example. That was the example given earlier. We're working with the Tulsa Health Department, which falls outside of our system. in public health in Oklahoma, but we're working with them to maybe create some more opportunities for their residents so they don't feel like they have to travel. We're watching what's happening and we're doing our best to adjust to that. But the number one thing that drives all of this is vaccine supply. And that's something that we just can't produce, and we can't meet everybody's need for that right now. But we know how important it is, and we're working on doing it.
Well, I just want to say thank you, thank you, thank you. Keith and Commissioner Frye, you are both steady public servants who have the greater good of Oklahomans in your heart and in your day-to-day work ethic. And I think we're lucky to have you in this state. And we appreciate you so much. We appreciate all your hard work. So, and thank you for talking to our members today.
Certainly. It's an honor to serve in this role right now.
Commissioner Frye, any closing words or comments?
I just want everybody to stay healthy. Please don't hesitate to reach out to us if you need more information or anything we can do to help you. If you're having difficulties with scheduling or whatever, please let us know. We're getting close. We're starting to see, even though our numbers, our cases are high. I mean, they're as high as they've ever been. Our hospitalizations are actually starting to stabilize and even come down a little bit. And I don't really know why. I think that we're doing we've done a lot of things working with the hospitals to try to improve their abilities to treat people on an outpatient basis and get them transferred to long-term care facilities or discharged home in a more rapid manner. And then we're getting vaccine out. So I think it's the combination of all those things, but it's that our cases are still high. I mean, high. So just be careful in this time frame. We're too close to the finish line to, you don't want to be the last soldier that's killed as the peace treaty is being signed, so let's get through this and get on the other side of it.
Commissioner Frye, Deputy Commissioner Reed, Jackie, thank you very much for leaning in on this. Adria, thanks for your good work on this topic. And this is not the last conversation that we're going to have about this on Morning Fuel. I want to remind participants that we got a couple of upcoming ones that I want to highlight. On January 20th, our Morning Fuel will be with Speaker of the House Charles McCall and Senate President Pro Tem Greg Treat. On the 27th of January, we will do a Morning Fuel with Chelsea Smith of Hall Estill, who will cover employment issues related to COVID-19 vaccine. On February 3rd, our Morning Fuel will be with Attorney General Mike Hunter. So please join us for that. Registration for all 3 upcoming webinars can be found at the Alliance website under the Events tab. And there you'll find also a complete list of the Alliance's 2021 events. With COVID-19 vaccines being administered, we look forward to an event schedule for 2021 more similar to those in the past. And our top priority remains the safety and well-being of our members. So we have altered our 2021 calendar a bit to include in-person activities later in the year, including our annual meeting. We will also continue to offer virtual presentations like this morning's Morning Fuel as an additional way our members can access vital and timely information. We appreciate your patience and ongoing support as the Alliance and the entire team navigates these waters. We look forward to being together again very soon. Thank you, folks. Be safe, mask up, be careful out there. Thank you. Appreciate it.